My name is David, so I'm a family physician by training. I think I've been working in public healthcare for the longest time. My last role was in the polyclinics as the Director of Clinical Services, which meant that I had to oversee the various clinical programs, the services that were being run in one of the polyclinic clusters in Singapore. So currently, I've been seconded to the Ministry of Health for the past 4 months. And within MOH, I'm overseeing a division that looks at primary and community care, which is sort of a wider scope beyond what I used to do in the polyclinic. So now I'm overseeing the polyclinics in Singapore, the GP sector, as well as some of the community care services that are going on. And I think that journey has probably been boosted a little bit by the experiences that I had gone through within the EMBA program. I think having seen many of my classmates perhaps change roles or change positions either during or after the program, I think sort of given me a little bit of that confidence and courage as well to do the same. So this step into MOH and this little foray into policy making, I suppose, is a step out of my comfort zone, perhaps armed with a little bit of confidence that the MBA program has given me. I knew that I wanted to be equipped with skills beyond what my own medical training had given me up till that point in my career. I think in terms of medical training as a family physician, I had completed the required postgraduate qualifications, which included a fellowship with the College of Family Physicians Singapore. And then entering into a little bit of that administrative or managerial work, I felt that I needed to be equipped beyond that medical knowledge. And that's what I thought the Masters of Business Administration would give me. For example, a little bit of formal learning and training in finance, which I don't think I had been exposed to before. I think the negotiation modules were very, very useful because I think even at the polyclinic level in that managerial position, I think having to learn and negotiate with the various stakeholders, coming to a win-win kind of solution rather than a win-lose, which is, what negotiation does teach you about, I think was quite useful. And definitely in my current role, I think many of the skills picked up did, I think, prepare me for where I am now. I look back at my EMBA experience and think with fondness and perhaps a little bit of pain as well, the management practicum that we went through, a group of us having to be involved in a project and bring that project to fruition, doing our primary interviews, primary research, as well as secondary research. Yeah, I think a lot of that I see very applicable to the work that I was doing in the polyclinics as well as now. Yeah, because many of the projects that I am involved in now, I think requires that kind of discipline and process as well. So again, having gone through that within the EMBA program, I think did help a lot in terms of preparing me for where I am. Well, I suppose if you are a doctor in that stage of your career where you are thinking about what is the next step for you, and that was something that I went through as well, having gone through clinical work. But now perhaps you have reached that epitome of your position of leadership within that clinical setting. But you're thinking about what is next for you. You might be thinking, or you might be slated for other roles within your organization, such as management. And that might be something worth considering at your stage in life. And then you might be offered some opportunities to upskill yourself. And, you would be offered the usual healthcare programs, or perhaps a program such as the MBA. And this is something that you might want to think about in depth. You might want to talk to some people, some of your colleagues or seniors who have gone through similar programs, whether it's a healthcare-related program with specifics in that, or a business program such as the EMBA. It might be something for you to think about. I had gone through the MBA route, and I think if you are looking at something beyond the norm, something that allows you exposure to classmates outside of the healthcare setting, something that exposes you to thinking that our friends in the corporate world have to go through considerations that they have to think about when it comes to financial implications of certain decisions that have been made, it might be worth thinking perhaps about a business program that might expose you to a lot more outside of the healthcare world. This is probably where you would have that conversation with your reporting officer or your boss or your HR officer in terms of what leeway and opportunities you can get. So I would tell you straight up front that the EMBA program is not a simple one. You will be required to put in quite a bit of effort. You would be required to pick up the books again and definitely for yourself as a healthcare professional, learn things that you had not learned before. It can be challenging, but I think if you do have the support of your family around you, your employers, your boss, then that would make your life a lot easier. I think having a little bit of flexibility in terms of how you manage your time, being allowed to take time off to attend your lessons, to attend preparations for your group presentations will help. So again, having that ability to negotiate with your reporting officer, with your boss, in order to be given that time off will be quite useful. I must say for many of my own classmates during the program, I think we had very understanding bosses and hospital colleagues who recognized that we would need to take time off during the time that we had physical classes, when we had to fly to a module that was overseas, and they were quite understanding, and that helped to make our lives a lot easier and helped us cope with the rigors of the course a lot better. So if you are thinking of embarking on the program, I think about the relationship that you have with your bosses, have that conversation with them. And I think if they are able to give you that support, I think it should be no problem for you to be able to go through this course. I wanted something with a strong international flavor, something that did not just limit me to a Singaporean or an Asian exposure, but something with a reach beyond that. So that's where the idea of doing the UCLA-NUS EMBA came up. I appreciated UCLA for the fact that it was in Western America. That's where much of the tech innovations were happening at that time. I think it did help that I had some good friends who had gone through a similar program as well. So they were able to share some of their experiences, and that sort of inspired me to think about that as well. For myself, I had done a medical fellowship in San Francisco early on in my career, and that did expose me a little to perhaps the American way of thinking and innovation, which did inspire me. So I think I was quite hopeful that I would experience a little bit more of that during the EMBA course as well, given that there was a large proportion of that teaching and learning going to be done in UCLA. There was therefore an understanding as well that many of my classmates would also be from that region of the world. And I was not disappointed. I did experience a lot of that in the teaching and the learning, as well as the interactions and networking with classmates that I came to know. During the program, I had a classmate, Ellen, who was actually an oncologist in America. So I think we were able to have some interactions. COVID happened during the time that I was in the course. So there were definitely discussions over how we were managing COVID in Singapore versus what was happening in the US. I think beyond just the course itself, the strong network that the both UCLA and NUS avail to you allowed me to interact with like-minded professionals, especially in healthcare, beyond just the course itself. And I continue to experience that as well. I think in the recent networking events, I was able to meet with some people who were bringing genetic tests into Asia, and seeing that kind of innovation and that kind of thinking and the considerations that people had going into that was quite illuminating. I think that sort of did gel with a little bit of the work that we are doing in Singapore with precision medicine. Again, I do appreciate that exposure that the course has given me.